Welcome to Module 2. The 6 rights of medication administration are: right child, right medication, right dose, right route, right time and date, and right documentation. In the following slides, each right will be discussed in greater detail. The 6 rights should be checked when receiving the medication from the parent, when removing the medication from storage, just before giving the medication, and when recording the administration of medication. Checking the 6 rights multiple times while administering medication will decrease the likelihood of medication errors, such as giving the medication to the wrong child, giving a child the wrong medication, or giving the wrong dose. The first right is making sure the medicine is given to the right child. Do this by matching the child's full name on the medication administration permission form, the written instructions or medical action plan, if there is one, and the medication label. It is good practice to attach a photograph to medication forms. Some forms even have a space for a photograph. Be sure the photograph is up to date, as children's appearance can change from year to year. If giving medication to an older child, ask the child to say their name, but avoid asking a yes or no question, like "Are you Thomas?" If not completely familiar with the child, or the child cannot say their full name, get help from someone who knows the child well. The next right is right medication. To be certain the right medication is being administered, check that the medication name on the label is the same as the medication name on the permission form. Ask these questions. If the medication is prescribed, is the name of the medication on the label the same one that was prescribed to this child? If the medication is for a chronic medical condition, is the medication the same as is listed on the medical action plan? And, is the medication name on the label the same one the parent authorized on the medication administration permission form? The next right is right route. Route is the way medications get into the body. Medications are designed for the specific opening or body surface where they are to be used. Giving medications by the wrong route may cause injury. To confirm how the medication is to be given, review the prescription or manufacturer's label and written instructions from the parent or healthcare professional. Oral medications are taken by mouth. Tablets are dry medications formed into a pill that dissolves after swallowing. Capsules are medications enclosed in a casing. Some tablets and capsules will not work properly if they are chewed, crushed, or cut. Always follow the instructions on the medication label. If in doubt, contact a pharmacist or the child's health care professional. Oral medications for children are often liquids to make them easier to swallow. The liquid medications can be solutions or suspensions, which are dry medications added to a liquid or syrup. Liquid medications need to be shaken well before being given. Some need to be refrigerated. Topical medications are spread onto the skin. They may be ointments, patches, creams, lotions, or powders. Inhalation medications are sprayed into the nose or mouth for the child to breathe in. Inhalers, sometimes called puffers, are used to inhale medications into the lungs by mouth. A device called a spacer should always be used with children, which allows the medication from the inhaler to mix with the air. This helps keep the medication from settling in the child's mouth and throat. Medications that are to be given by a machine called a nebulizer come packaged in ampules, or small plastic containers with a twist-off top, which is added to a nebulizer cup and attached to a compressor using plastic tubing. This process changes the liquid to a mist to be inhaled by the child. For training and technical assistance in caring for children who need inhalers or nebulizers, contact a child care health consultant. Instillation medications are put into the ear, eye, or nose. These can be drops or thicker ointments. Some medications are delivered by implanted pumps, which are attached to the body. These are called infusions. The medication to be delivered is programmed into the device that controls the pump. Other medications are given rectally, such as suppositories or rectal gel, which comes in a prefilled syringe, to be inserted into the rectum. Injections are given through the skin with a needle. Some injections come in a pre-filled syringe, such as epinephrine auto-injectors or insulin pens. and some come in bottles that have to be drawn into a syringe before use. The next right is right dose. The right dose means giving the same amount of medication the healthcare provider has prescribed for the child, or the manufacturer of the medication recommends, and that the parent has authorized to give. For example, topical medications may say use exactly the amount indicated on the label. Some topical medications can become less effective if too much is used at a time. Some topical medications may say a dime-sized amount or a pea-sized amount. All medications must be measured using the measuring device that came with the medication. Do not rely on household items such as spoons. These items are not accurate ways to measure medication. The next right is the right date and time to give the medication, according to instructions from the parent or healthcare professional. As a reminder, scheduled medication should be given at the time specified by the parent. As needed medications are given based on written criteria or symptoms to look for when the child needs the medication and a specified time interval between doses. For medications given on an as-needed basis, ask the family during drop-off when the child had the last dose, so the medication is never given before the necessary amount of time has passed. Then, during pickup, let the family know if and when the medication has been given. Knowledge check time. Giving a medication by mouth is an example covered under which. The sixth right is documentation. Certain documentation, such as written parental authorization, written instructions from the parent or healthcare professional, and medical action plans for emergencies must be in place before medications are administered. These are all examples of right documentation. After giving medication, the dose must be recorded on a medication administration record. We will now go through the procedure for administering medication, putting into practice the steps of medication administration. Remember, however, that this training does not cover the hands-on skills you need to administer medication safely. Child care health consultants can provide training and technical assistance for medication administration skills and how to recognize and respond to emergencies that children with special health care needs may have, such as asthma, allergies, seizures, or diabetes. The first step involves reviewing written instructions on the medication permission form and medical action plan. The next slides will show visuals of these forms and plans for review. On screen is an example permission form that is also available in the resources section of this course. Using the 6 rights, understand what the medication is, what the dosage is, what route to give the medication, the dates and times to give the medication, how long the permission is valid for, any special instructions, and possible reactions or side effects. Here is the medical action plan example, also available in the resources section. As with the permission form, using the 6 rights, understand what the medication is, what the dosage is, what route to give the medication, the dates and times to give the medication, how long the permission is valid for, any special instructions, and possible reactions or side effects. Early educators who are administering medication should wash their hands before handling medication and giving the medication to the child. The next step is to remove the medication from storage. If the medication was in locked storage, take the medication out and relock the medication storage container right away. Make sure the medication is in the original container. Read the label for handling instructions, and check that it has been stored correctly. The next step is finding the child and reviewing the 6 rights. Check that the name of the medication on the permission form is the same as the name of the medication on the container. That the name of the child on the medication container is the same child to whom you will give the medication. And that the date, times, dose, and route on the written instructions from the parent or healthcare professional match the dates, times, dose, and route on the pharmacy or manufacturer's label. Early educators should only administer medication if they are trained to give the type of medication that needs to be given. They should seek out additional skills-based training on the type of medications that are necessary to give to children in their care. And only early educators who have checked the 6 rights and prepared the dose for the child themselves should give the dose. After administering medication, hands should be washed, and the medication returned to storage. Except for over-the-counter, non-medicated items applied to a child's teeth, gums, or skin, such as sunscreen, lotions, or non-medicated diaper cream, all doses of prescription and over-the-counter medications must be documented. The medication administration record must include the child's name, the date and time, amount and type of medication given, and the name and signature of the person giving the medication. Medication administration records must be kept and available for review by DCDEE while the medication is being given, and for 6 months afterward. Since young children cannot always express the changes they may feel, they need to be watched carefully for side effects and adverse reactions. Medication labels, or written instructions from the parent or healthcare professional may list information about possible side effects or reactions from the medication. Side effects or reactions can also be looked up on medlineplus.gov, which is a service of the United States National Library of Medicine. Side effects and adverse reactions are both possible outcomes after a child is given a dose of medication. The difference is that side effects are predictable. These can be unpleasant but often do not cause lasting problems. Common side effects are dry mouth, dizziness, drowsiness or excitability, flushing or sweating, or nausea. Side effects most often occur when a person is starting or increasing the dose of a medication. Adverse reactions are unexpected, harmful, or potentially life-threatening. Anaphylaxis, which is a severe allergic reaction to a medication, can occur with any dose, even if a child has had the medication before. Symptoms of anaphylaxis are trouble breathing, hives or swelling, tightness of the throat, hoarse voice, nausea, vomiting or abdominal pain, diarrhea, fainting, low blood pressure, or rapid heartbeat. All side effects and adverse reactions should be documented on the medication administration record. In case of a serious adverse reaction, such as severe allergic reaction or anaphylaxis, seizure, difficulty breathing, passing out, or chest pain, provide first aid, CPR if needed, and call 911 immediately. Follow the program's written emergency medical care plan. This plan outlines the steps to follow in the event of a medical emergency. Always notify families and the director as soon as possible and complete an incident report once the child is safe. Early educators who stay focused when handling medications and follow the proper procedures for receiving, documenting, storing, and disposing of medications can avoid the common violations listed here. Common violations in child care centers and family child care homes are 1. Medications not stored correctly. Remember, all medications, except for emergency medications and over-the-counter, non-medicated topical items, must be stored in a locked cabinet or container. 2. Permission forms were missing or did not contain all required information, such as a lack of criteria for giving as needed medications, or medications without the expiration date listed. And 3. In child care centers, leftover medications were not returned to the parent within 72 hours. Medication errors occur when one of the 6 rights go wrong, including giving medication to the wrong child, giving the wrong medication to a child, giving the wrong dose, giving medication by the wrong route, giving medication at the wrong time or date, and giving medication without necessary documentation. The consequences of medication errors can be serious and cause injury to a child. Checking the 6 rights as described in this training can help avoid these serious mistakes. Document medication errors on a medication error report and fill out an incident report. Early care and education programs who have medication errors should request additional training and technical assistance, and review their policy and procedures for any changes that need to be made. Consequences to children who have received medications in error must be addressed immediately. Most of the medication errors, except documentation, will be urgent or even an emergency. If the error results in the wrong child receiving medication, or the wrong medication, dose, or route is used, call poison control immediately. They will advise what steps to take next. This may include first aid, calling 911, or contacting the child's health care provider. Always notify the parent and director of the error as soon as possible. Do not wait until the end of the day. If a child does not receive a full dose of medication because they refuse, spit up or spit out the medication, or vomit after receiving the medication, it is usually not possible to determine exactly how much medication has been absorbed into the child's body. If this happens, inform the parent and director. Seek guidance from a healthcare provider or pharmacist if there is any question about whether the child should receive an additional dose. Document the situation on the medication administration record. On screen is an example of the medication poster previously mentioned in this training. Posters are available for order that outline receiving, storing, and administering medications from the North Carolina Child Care Health and Safety Resource Center. For additional training, contact a child care health consultant. Other training options include medication administration skills and trainings on children with special health care needs such as asthma, allergies, anaphylaxis, diabetes, insulin, and seizures. This is the end of Module 2. Continue on to additional activities and modules.